thyroid gland. And it's not palpable, ما بحس تحت إيدي أي شيء. It weighs 15 to 20 grams. It is responsive to stress by production of the T3 and T4. Developmentally, it rises from the pharyngeal tissue in the neck. يلا بسرعة بسرعة. Sometimes, along the descent of the thyroid into its position in the anterior parts of the neck, بتصير في abnormal descent. إما بتكون lingual thyroid, بتكون الثايرويد is just behind the tongue or on the posterior aspect of the tongue, or sometimes it descends more than expected to substernal or sternal.
اكيد انت مشون.
لا انا مشون. حلو.
يلا بسرعة لو سمحتوا. يلا please. احنا كنا عم نحكي على introduction to the thyroid gland structure and the physiological division. يلا please. Structurally or histologically, it is composed of varying size follicles. بسرعة بسرعة لو سمحتوا خلص يلا فكروا فيه بلاش حكي. يلا please. So structurally, it's composed of varying size follicles lined by columnar epithelium, هلا رح فرجيكم عليها صورة, filled with colloid, and in between these follicles في interfollicular cells أو اللي بنسميهم C cells, which are important in calcium metabolism. Secretion of T3 and T4 is controlled by trophic factors from the hypothalamus and the anterior pituitary, so they are under the control of the anterior pituitary and the hypothalamus. وهلا بعد شوي لما نحكي عن الهايبرثايرويد رح primary disease of the glandular tissue معناها ايش؟ شو يعني primary مثلا hyperpituitarism or hyperthyroidism شو معناها primary؟ ممتاز. It's from the organ itself. Secondary
another organ.
من controlling part يعني على الأغلب بالنسبة للثايرويد from the pituitary بسميها secondary hyperthyroidism. The tertiary إذا كان from the hypothalamus a higher even a higher organ. This is the normal structure of the thyroid gland, which I think colloid, compressed tissue is flat epithelium, and in between the C cells. هذا اللون pink in the middle, this is the colloid, and these are the follicular cells around the colloid. بتكون مع بعض لا تحكوا خلاص. And its C cells are in the stroma in between. لكن كيف شكل normally thyroid gland, the cells are flattened, devoided to flattened. عشان هيك بعد شوي رح نشوف بعض الديزيزز بتصيروا thyroid أو follicular cells are enlarged or columnar بعد شوي. Thyrotoxicosis is a hypermetabolic state caused by increase in the levels of T4 and T3. It could be associated with hyperthyroidism. Hyperthyroidism زي ما حكينا معناته source of the thyrotoxicosis is within the thyroid itself. يعني في overproduction of T3 and T4 بسميها hyperthyroid. Thyrotoxicosis is the clinical manifestation. شو اللي بيصير عند البيشنت؟ كيف بيبين عنده effect of the elevated T3 and T4 بسميها thyrotoxicosis. The clinical effect اللي بتبين على البيشنت. الهايبرثايرويدزم معناته thyroid is overfunctioning. So thyrotoxicosis could be associated with hyperthyroidism or not associated with hyperthyroidism. So associated with hyperthyroidism معناته في overproduction of T3 and T4 either due to causes inside the thyroid gland, which are examples Graves' disease, toxic spontaneodular goiter, and toxic adenomas. رح نحكي عنهم كلهم in details. Or secondary to a pituitary stimulating hormone oversecretion that stimulates the thyroid to function more and leads to hyperthyroidism. The thyrotoxic cases that are not associated with hyperthyroidism are بيكون production of T3, T4, the function is normal, but something is happening leading to elevated T3, T4. زي ايش مثلا؟ زي thyroiditis. Thyroiditis with inflammation, the cells are functioning normally, بس ليش بصير في عندي thyrotoxicosis أو elevation in the level of T3, T4? We see destruction of the follicular cells and abnormal release of T3, T4 into blood. Okay? But the function itself is, they are not hyperfunctioning follicular cells. Stroma ovarii هي عبارة عن ايش؟ لسه ما أخذت الفيديو صح. Stroma ovarii هي a teratoma tumor that happens in the ovary. شو يعني teratoma؟ لما أحكي teratoma إيش معنى تيومر؟ ممتاز. بيكون في 3 germ cell layer components يعني tumor which is benign وبيطلع منه أي type of tissue موجود in the body arising from the 3 germinal cells. The stroma ovarii لما هذا الovarian tumor differentiates into thyroid tissue. بيكون شكل ovarian tumor, ovarian teratoma طلع thyroid tissue and these are functioning. هذول thyroid tissue and the ovary they produce T3 and T4 and leads to thyrotoxicosis. Or exogenous thyroxine intake, new drugs from outside. هذول cases, the 3 cases حكينا, they are not associated with hyperthyroid. The thyroid function itself is, our follicular cells are functioning like normal, but see something happening like that led to elevation of T3 and T4. مفهوم؟ Clinical pictures related to sympathetic stimulation due to elevation of T3 and T4 is with thyrotoxicosis. شو بيصير عند هذول patients اللي عندهم thyrotoxicosis? They present with symptoms related to the heart, cardiac symptoms, palpitation, tachycardia, which are the earliest and the most consistent feature. يعني palpitations والtachycardia موجودة بكل الناس اللي عندهم thyrotoxicosis, and it's the earliest sign. يبلش عندهم palpitation مع increase in the heart rate. Heat intolerance, sweating and warm skin, hypermotility, malabsorption, weight loss, despite good appetite, they start to lose weight. عشان هيك أكثر الناس اللي عندهم thyrotoxicosis are skinny, يكونوا كثير إنهار. And in females, they might present with menstrual disturbances, neuromuscular tremors and muscle weakness. Usually the tremor that is associated with hyperthyroidism is what we call fine tremor. شو يعني fine tremor؟ يعني تكون الإيد بترجف هيك رجفة خفيفة. Okay. Ocular symptoms, wide staring gaze, lid lag, thyroid ophthalmopathy رح نحكي عنها in details. And the thyroid storm, when there is severe acute symptoms, sympathetic overstimulation ممكن يكون life-threatening sometimes. These are the faces, and this is the face of a patient with thyrotoxicosis. شايفين exophthalmos, الeye يكونوا protruding outside. رح نحكي على specific diseases that are associated with exophthalmos اللي هو أكثر واحد هو Graves' disease. Usually they are anxious حكينا skinny, they do not tolerate heat دايما هميانين, they lose weight and so on. Diagnosis of hyperthyroidism. Again, hyperthyroidism is something happening in the thyroid. صح؟ thyrotoxicosis is either associated with hyperthyroidism, معناته follicular cells are hyperfunctioning, or not associated with hyperthyroidism, something happening leading to elevation of T3 and T4 while the thyroid is functioning like normal, or the follicular cells. So how do we determine hyperthyroidism, or when do we diagnose a patient into hyperthyroidism? The most important and the most useful screening test is the level of the TSH. The TSH, the thyroid stimulating hormone, when the thyroid gland is hyperfunctioning and producing T3, T4, we have a feedback mechanism ايش بصير بالTSH. بالفعل, yes. So decrease in the TSH and increase in free T4. In secondary thyrotoxicosis, اللي هو بيكون فيه overproduction of TSH, شو بيكونوا؟ secondary hyperthyroid أو secondary thyrotoxicosis بيكون TSH عالي وال T4, T3 كمان عالي. Okay? In some patients, بصير في elevation of T3 only, T4 بيكون normal or decreased. Tertiary hyperthyroidism, إذا تتذكروا حكينا إنه it could be كمان related to the hypothalamus. This is due to increase in the thyrotropin releasing hormone أو TRH from the hypothalamus. بيعلي TSH, with TSH it affects the thyroid to produce more and more of T3 and T4. So TSH is important and useful in the differentiation بين إيش وإيش. متى بيكون نازل؟ primary. ممتاز. بيكون source of T3, T4 overproduction is the thyroid. Via feedback inhibition بقلل TSH from the pituitary. While in secondary and tertiary hyperthyroid بيكونوا TSH بيكون عالي. Okay. Hypothyroidism. حكينا على hyperthyroid and the causes of the thyrotoxicosis and how to diagnose it. Hypothyroidism لما يكونوا T3, T4 levels are decreased. ليش بصير الhypothyroidism? It could be primary, secondary and tertiary as well. Primary causes related to the thyroid itself, so autoimmune mechanism. رح نحكي عن Hashimoto's thyroiditis in details. Iodine deficiency, especially in endemic areas. The raw material for production of T3, T4 is not there. وما بصير في production of T3, T4. Surgical excision or radiation of the thyroid gland. Congenital enzyme deficiencies. See, a lot of the congenital diseases affecting the thyroid, while the thyroid cannot produce T3, T4 congenitally. رح نحكي على خطورتها على brain development. Drugs like iodine and lithium. And thyroid dysgenesis كمان هذا developmental abnormality where the thyroid is not present. بيكون ما عندهم thyroid gland or it's much smaller than the normal. Secondary and tertiary, either failure of the pituitary gland or the hypothalamus. Hypothyroidism is commoner in endemic areas of iodine deficiency. زي ما حكينا, when the raw material is not there, ما بصير في production of T3, T4. بالعكس, the follicular cells, they try to compensate by proliferation, abnormal response. عشان هيك they end up هدول الناس عندهم iodine deficiency. بعد شوي رح نحكي على شيء بنسميه المالتي نودولار جولتر. بخرب الستركتشر او الشكل تبع الثايرويد كلها بتكبر وبتصير فيها نودولز. هلا رح نحكي عنه in details. رح نحكي على الديزيز in details. Hypothyroid in infancy and is related to onset of deficiency. If early in life, يعني زي مثلا اللي عندهم developmental dysgenesis أو عندهم مثلا المother كان عندها iodine deficiency when she was pregnant with the baby, بيعمل إشي بسميه cretinism. The cretinism is hypothyroidism in an infant or a newborn شو يعني newborn؟ يعني تحت الشهر. بعدين infant، ده متى بسميه infant؟
سنة.
قبل السنة excellent. So من شهر لسنة بسميه infant. So these newborns or infants, when they do not have enough iodine for the production of T3, T4, بيعمل لهم شيء اسمه cretinism. أفرجيكم الصورة. بالcretinism بصير في عندهم mental retardation لأن thyroid hormones are important for the development of the brain بالصغار. So بالcretinism they present with mental retardation, بيكونوا short stature أكثر من النورمال. وبيكون في عندهم كمان another feature which is very alarming, protruding of the tongue. بيكون البيبي دائما شبه مفتوح ولسانه طالع. This is very alarming for hypothyroidism. And because this is preventable, إذا بنعطيهم thyroxine early in life ما بصير في عندهم mental retardation and they do not develop this picture, this is treatable. So it's very important to be detected early in life. يبقى الدول تعمل screening for حتى الأردن. It's supposed the doctor is supposed to do screening for the thyroid gland لكل البيبيز, newborn babies, to avoid the development of cretinism due to hypothyroid. They also have hernias and protruding tongues زي ما حكينا. الميكسيديما اللي هي hypothyroidism بالكبار بسميها ميكسيديما. And these patients عكس الناس اللي عندهم hyperthyroid بيكونوا apathic, عندهم slow mental processes, they do not tolerate the cold weather, accumulation of mucopolysaccharide in subcutaneous tissue بنسميها pretibial myxedema, deepening of the voice and constipation. So these are the presentations of the hyperthyroid. Accumulation of mucopolysaccharide in the subcutaneous tissue بيصير هلا بعد شوي رح تشوفوا لما نحكي على Graves' disease which is a hyperthyroid disease رح نحكي على pretibial myxedema. The pretibial myxedema happens in both. بيصير في accumulation of abnormal mucopolysaccharides, hyaluronic acid products, most commonly anterior to the tibia. عشان هيك بيسموها pretibial myxedema, and it happens in hypothyroidism and hyperthyroidism, so it's a sign of both. And usually it happens late in the onset of the hyperthyroid. هلا رح نحكي عنها. رح نرجع نشوفها بالGraves' disease اللي هي الميكسيديما. lab tests ايش اللي بيصير؟ شو بتتوقعوا لما يكونوا T3 T4 are decreased؟
هاي TSH.
ممتاز، بصير في feedback increase in the levels of the TSH. وزي ما حكينا if the iodine is not there, even if the follicular cells try to compensate for or to respond to the TSH level which is high, ما رح يصير في عندي production of T3 T4. بالنهاية زي ما حكيت لكم بصير شكل الثايرويدز abnormal، ببلش يصير في nodules ويصير very enlarged. رح نحكي عنها in details. مفهوم لهلا؟ Thyroiditis أي شيء فيه الsuffix itis معناها inflammation. Thyroiditis is inflammation of the thyroid. حكينا it's one of the causes of thyrotoxicosis that is not associated with hyperthyroid. ايش اللي بصير؟ inflammatory cells بيعملوا destruction of the thyroid أو follicular cells فبيطلعوا T3 and T4 more than expected and leads to thyrotoxicosis in some of the cases. رح نحكي عليهم in details, which is chronic lymphocytic thyroiditis أو Hashimoto's disease, Hashimoto's thyroiditis, subacute granulomatous thyroiditis or Dequervian thyroiditis, subacute lymphocytic thyroiditis, and bridal thyroiditis. With the fifth one, palpation thyroiditis, we'll not mention it. Hashimoto's thyroiditis, which is chronic lymphocytic thyroiditis. معناته إيش الهولمارك feature من اسمها؟
lymphocytosis.
Lymphocytes ممتاز. في infiltration of the follicular cells by lymphocytes. Mostly it is an autoimmune disease characterized by progressive destruction of the thyroid tissue. شو يعني progressive؟
سيفيري.
يعني progressive معناته بتزيد severity with time، يعني يبلش أول شيء شوي mild destruction، بعدين with time بيزيد. أي disease يصير بهاي الطريقة اللي هو ببلش شوي mild بعدين بيزيد بالseverity بسميه progressive disease. And Hashimoto's thyroiditis is one of these diseases, so there is progressive destruction of thyroid tissue. It's the commonest type thyroiditis. The commonest cause of hypothyroid area of sufficient iodine levels. ايش اللي بيصير بالهاشيموتو's thyroiditis؟ In the early stages لما يكون في infiltration and destruction of the follicular cells، ورح نشوف هلا الميكانيزم. بصير في release T3 T4. So initially early in the disease شو بيكون عندهم hyper ولا hypothyroid؟ hyperthyroid. بعد فترة لما يصير في more and more destruction of the follicular cells
hyperthyroid.
يصير hypo. So it's the commonest cause of hypothyroid in areas of sufficient iodine levels. It's much commoner in females 10 to 20 to 1, and the age is usually 40s to 60s. Pathogenesis, the Hashimoto's thyroiditis, ايش اللي بيصير فيها؟ بيصير فيها destruction via the cytotoxic T cells, CD8 positive cells, CD4 positive cells, and involvement even of autoantibodies to the thyroid gland. عشان هيك بيكون destruction is progressive. More and more lymphocytes got recruited, more and more activation of the macrophages, more and more production of autoantibodies until the majority of the thyroid tissue becomes disrupted. So T cell sensitization to thyroid antigens, which is زي ما حكينا autoimmune. So they start هدول T cells they start attacking the cell اللي هم follicular cells. Either through CD4 positive T cells producing interferons, and these interferons they activate and recruit more and more macrophages وبيعملوا death of these or destruction of these follicular cells. Or CD8 mediated cytotoxicity, or زي ما حكينا auto antibodies, anti-TSH receptors, anti-thyroglobulin and anti-thyroid peroxidase antibodies, followed by antibody-dependent cell-mediated cytotoxicity. It has a genetic predisposition, so في بعرف إنه في أي disease قديش contribution of the genes in this disease في بعرفها دائما نستدل عليها بالconcordance of the disease and identical twins اللي هم أو monozygotic twins. ليش؟ same genes ممتاز لأنه المونوزايغوتيك twins كيف بيتكونوا المونوزايغوتيك twins؟
From the same eggs. From the same eggs. نفس البويضة يعني.
Yes. An egg gets fertilized by a sperm بعدين تنقسم قبل ما يصير لها implantation. So they carry the identical twins or the monozygotic twins, they carry exactly the same genes. لأنهم طالعين أصلاً من sperm fertilizes an ovum بعدين قبل ما يصير لها implantation تنقسم got implanted as two people or as twin. So they have the exact same genetic makeup. يعني نفس الجينز بالmonozygotic twins. So the concordance rate is an indication or it gives an idea how much the genes contribute to the disease. So in Hashimoto's thyroiditis, there is almost 40% concordance in monozygotic twins. So this is considered a high percentage. So genes plays a role. بكل الautoimmune diseases. كل الautoimmune diseases بيكون في عندي environmental factors صح؟ genetic predisposition and something happening that breaks هذول يعني يصير في self antigen أو اللي هو production of immunity against self antigen. So it is associated with pleomorphism in cytotoxic T lymphocyte-associated antigens, and it has a higher risk in Down syndrome and Turner syndromes. الناس اللي عندهم trisomies يكون عندهم higher risk. So this is an illustration of, so starting from the left side, the CD8-mediated cytotoxicity to the follicular cells, and the destruction of the follicular cells, and then زي ما حكينا CD4 helper cells, it activates macrophages, and the macrophages leads to more and more destruction of the follicular cells. And on the far right side, the plasma cells, they produce autoantibodies. There are a lot of autoantibodies produced in Hashimoto's thyroiditis that leads to destruction of the follicular cells. مفهوم لهلا؟ حدا عنده سؤال؟ Clinical features كيف بيجوا الناس اللي عندهم Hashimoto's thyroiditis? They present with painless symmetrical diffuse goiter. يكون في عندهم enlargement of the thyroid gland. Thyroid gland بتكبر and it's painless ما فيها ألم. Initially زي ما حكينا بيكون فيها thyrotoxicosis or hashimotoxicosis. لما بصير في enough destruction, more and more progression of the disease and enough destruction of follicular cells, بصير في عندهم hypothyroid. Very importantly, the patients have increased risk of B-cell lymphoma لأنه the T cells أو the lymphocytes in general are overacting, so they might transform into malignancy, especially for the B cells. Okay, so the gland is smooth زي ما حكينا ما فيها nodules. شو يعني nodules؟ يعني ما فيها كتل. تكون the gland is enlarged and smooth to vibration. ما بحس تحت ايدي masses. مش nodular ما فيها nodules. هلا رح نشوف شو يعني كيف الnodules تبين. And what demarcated? Microscopically, the whole feature or the most important feature هي ايش حكينا؟ lymphocytes. In addition to the lymphocytes, في عندي شيء بسميه helper cell change. محطوطة هون بالبولد. Helper cell change. So dense infiltration by lymphocytes and plasma cells, formation of lymphoid follicles رح بجيكم إياها, and helper cells. Fibrosis might be present but does not extend outside. ليش does not extend outside is important؟ لأنه بعد شوي لما نحكي عن Rydell's thyroiditis أو fibrosing thyroiditis بيكون fibrosis is outside, extending outside of the gland. بينما late stages of Hashimoto's thyroiditis بصير في fibrosis بس مش برا الجلاند، يعني بيكون بس confined to the thyroid gland. هاي شكل Hashimoto's thyroiditis. ايش هدول الستراكشرز؟ rounded structures، ايش هدول؟ follicles, excellent. follicles with germinal centers. الاريا اللي بتكون pale فيها germinal center. متى بيصير بالليمف نود germinal center؟ لما تكون proliferating actively. في something is stimulating these lymphocytes to proliferate and produce more and more of lymphocytes and antibodies. So هدول areas اللي around, these are lymphocytes with germinal centers. طيب on the left side, on the left lower side ايش هذا؟ لا هدول لسه يعني هلا بفرجيكم الهيربل cells، مش مبينين كثير انه هيربل cells. These are the follicles. لسه في شوية follicles من الثايرويد on the side or in between the inflammatory cells. الهيربل cells هم هدول. شايفين البيج cells؟ البيج cells that have eosinophilic pink cytoplasm on the right side. These are the helper cells. ايش بيصير بالهيربل cells؟ يعني what is the change that causes the cells to be helper؟ helper يعني لونها اول شيء السيتوبلازم بيكبر وبعدين بصير في لونها eosinophilic. eosinophilic يعني زهر. شو اللي بيخلي السيلز تكون هيربل؟ يعني مش بس بالثايرويد، كمان بنشوفهم بأذر organs مثلا بالكدني tumors بأذر. So helper is an indication انه شو بصير؟ enlargement. بس ايش اللي بيعطي هذا الكيك؟ Yes, it is an indication that the cells are regenerating very slowly. الhair cell cells أو الhair cell appearance of the cell is due to accumulation of mitochondria. بصير في mitochondria بزيد عددها بالcytoplasm and it gives the cells this appearance. And this is an indication إنه the cell has gone through a long gradual process. يعني صار فيها مثلا هون inflammation that was prolonged and they started to regenerate and this led to the formation of hair cells. Okay? And the hair cells اللي حكينا الهاشيموتو's thyroiditis فيها lymphocytes with formation of lymphoid follicles, فيها hair cells وفيها fibrosis in late stages. So hair cells are very characteristic of مين اللي بيحكي هنا؟ Please لو سمحتوا. The hair cells are مع lymphoid follicles are characteristic of Hashimoto's thyroiditis. مفهوم Hashimoto's؟ طيب subacute granulomatous thyroiditis من اسمها granulomatous معناته شو بشوف فيها؟ granulomatous. The subacute granulomatous thyroiditis is different from the thyroid اللي هو Hashimoto's thyroiditis. This is usually could be related to a viral etiology, viral infection of the thyroid gland, بيعمل لي a response of the thyroid gland via reduction of multinucleated giant cells granulomas. This disease is self-limiting and painful, مش زي Hashimoto's. يصير في enlargement of the thyroid with pain. The thyroid gland, with painful thyroid gland, and they might present with fever, elevated ESR, and elevated white blood cells, which gives an indication that there is something infectious happening. Fishy infection underlying this disease. And it is self-limiting within 6 to 8 weeks. Within 6 to 8 weeks, you see the resolution of the inflammation to turn the thyroid into its normal function. So then these 6 to 8 weeks, they present with transient thyrotoxicosis. زي ما حكينا, whenever there is destruction of the follicular cells, بصير في عندي elevation of the T3, T4 in the early onset of the disease. Morphology, it's a firm than destruction of acinylates to mixed inflammatory infiltrate, neutrophils, macrophages, and giant cells with formation of granulomas. هاي شكلها under the microscope. شايفين هذول big cells, big giant cells, هذول multinucleated cells. There are also inflammatory cells, lymphocytes in between. مش شايف في remnants of thyroid tissue. على الأطراف هذول they are forming granuloma حوالين multinucleated giant cells. زي ما حكينا, they present with acute onset of painful enlargement of the thyroid. And it's self-limiting within 6 to 8 weeks after a period of transient thyrotoxicosis. هذا السؤال. I'm not sure والله مش معروف إنه this is a hypothesis يعني مش معروف إنه certain virus so viral etiology جنبها علامة سؤال. So most likely it's related to infection by a virus, بس مش معروف. ما في well-established association between certain viruses and development of hyperthyrotoxicosis. Initially, in the initial transient thyrotoxicosis, لأنه في destruction of the lymphocytes, بس ما في organization of fibrosis زي ما بصير بالهاشيموتو's. This is something transient. بصير like for example 1 month, 2 months, بعدين it resolves by itself. ما بصير في enough destruction or diffuse destruction of the follicles, they regenerate the follicles, the inflammation resolves and they go back to normal, euthyroid state. Subacute lymphocytic thyroiditis. وين شفنا الليمفوسيتيك thyroiditis؟ وين سمعنا عنها؟ حكينا على الهاشيموتو's thyroiditis. ايش
lymphocytic infiltration.
ايش الاسم الثاني للهاشيموتو's thyroiditis؟
chronic
lymphocytic thyroiditis. This is a disease which is similar to Hashimoto's thyroiditis, subacute. So most commonly The presentation is very mild. ما في مش زي الهاشيموتو's thyroiditis ما بصير في very severe inflammation. فيها lymphocytic infiltration. Usually or most of the time بتصير postpartum thyroiditis. شنو هي postpartum؟ بعد الولادة تصير في thyrotoxicosis that is related, mild thyrotoxicosis related to lymphocyte inflammation. شكلها it could be related to autoimmune diseases. It may recur in subsequent pregnancies and then progress to hypothyroid. Sometimes it follows the same disease progression of the Hashimoto's thyroiditis, but most of the time لا ما بتعمل hypothyroid. Histology تشبه الهاشيموتو's thyroiditis without hurtful cell metaplasia. حكينا الهرتل cells ليش بصيروا؟ لأنه بصير في a long period of chronic lymphocytic thyroiditis. A long period of inflammation and distraction leads to regeneration of these cells, and these cells, when they regenerate, they acquire more and more mitochondria for production of energy, more and more energy. The subacute lymphocytic thyroiditis ما فيها hurtful cell metaplasia. آخر نوع رح نحكي عنه اللي هو الرايدلز thyroiditis. تذكروا احنا حكينا الهاشيموتو's thyroiditis ما بيكون فيها أو بيكون فيها fibrosis, but this fibrosis does not extend outside of the gland. Raidl's thyroiditis usually dense fibrosis that extends outside of the thyroid gland. ممكن يعملها adherence to the petracheal fascia, to the structures around. So dense fibrosis without prominent inflammation involving the thyroid and contagious neck structures. كل neck structures around the thyroid ممكن يصير فيهم fibrosis. Associated with idiopathic fibrosis in other sites of the body. في عندنا diseases اللي بنسميه idiopathic fibrosis. بيعمل fibrosis in multiple areas of the body. Like for example, Kawasaki is something different. هذا is not related to viral infection, okay? This disease, idiopathic fibrosis, يصير في عندهم retroperitoneal fibrosis, يصير في عندهم fibrosis affecting multiple organs منهم الثايرويد. And circulating anti-thyroid antibodies question mark مش دائما بيكون فيه. It could be part of the disease اللي هو idiopathic fibrosis, diffuse idiopathic fibrosis. This is the appearance of Raidl's thyroiditis. شايفين الpink areas, the pink structures هذا كله collagen deposition. والfibrosis is شو الfibrosis؟ لما بحكي fibrosis شو بيكون؟ collagen. The fibers of collagen deposition not in an abnormal places أو in places زي مثلا بالscar tissue. وين ما كان في collagen deposition, this leads to fibrosis. And this is the appearance of Raidl's thyroiditis. كل هذول pink structures, these are all collagen fibers deposition around the follicular cells, the remaining or residual follicular cells. هذا عنده سؤال؟ نحكي عن Graves' disease. إذا بتتذكروا هلا خلصنا الانفلاماتوري كونديشنز، خلصنا الثايرويدايتس، كل شيء بيجي تحت عنوان الثايرويدايتس. حكينا عن الهاشيموتو's، حكينا على ديكويريال thyroiditis, subacute lymphocytic thyroiditis, والرايدل thyroiditis. هلا الجريفز disease is something different. The Graves' disease it involves inflammation in a way. بس الفكرة فيها بالجريفز disease is the very hyperactive cells. هذول ليش بيصيروا الhyperactive follicular cells؟ بيصير فيهم stimulation by antibodies or autoantibodies. هذول الantibodies they bind to the TSH receptors وبيشتغلوا شغل TSH. يعني زي كأنهم irrespective of the TSH level of the pituitary, هذول autoantibodies يمسكوا على the receptors for the TSH and it stimulates the follicular cells to produce more and more T4. So the commonest cause of endogenous hyperthyroidism, age is between 20 and 40. In males to females ratio, it's much more common in females. كل autoimmune diseases are much more common in females. more common in Western races. The main features of Graves' disease: thyrotoxicosis with a small symmetrical enlargement of the thyroid. Thyroid is becoming very active, تكبر وبتكون smooth ما فيها nodules ما فيها masses يعني smooth معناته أو smooth symmetrical enlargement معناته الثايرويد كلها كبرانة وما فيها ما في masses formation. Infiltrative ophthalmopathy with exophthalmos in 40% of the cases. وهلا رح نحكي ليش بصير. Pretibial myxedema in a minority. So pretibial myxedema حكينا بنشوفها بالهايبوثايرويد وبالجريفز disease. Lab findings increased T4, T3 and TSH level is decreased. يعني لأنه pituitary gland بتقلل ال TSH level بس at the same time في auto antibodies binding to the TSH receptors and stimulating the cells. Radioactive study, diffuse uptake of radioactive iodine. هلا رح نحكي عن radioactive study بالنيوبلازمز رح أفرجيكم شو يعني. Pathogenesis of Graves' disease حكينا genetic etiology and autoimmune process. So genetic evidence, it may be familial. شايفين very high concordant rate in identical twins, about 60%. Some of the genes are more susceptible, or the HLA groups are more susceptible to having Graves' disease, HLA-B8 and TR3. It might exist like كل autoimmune diseases. أي autoimmune disease it might exist with another autoimmune disease زي مثلا SLE, pernicious anemia, diabetes type 1 and Addison's disease. Immune mechanism زي ما حكينا there is production of autoantibodies or antibodies to thyroid peroxisome and thyroglobulin. ناخذ بريك طيب break for 10 minutes بس ماشي يعني 10 minutes بكونوا